Shoulder OA. You got to move it. You got to move it. Remember that? I mean, come on, Pumbaa or whoever did it better than us.
I think they did pretty good. But the point is so important. You got to move it.
Which is different because we did another segment on shoulder OA, which is a lot of trunk. This one really starts to get your shoulder moving. So I think combining the two will really give you some good results. So this is a 2022 study by Larson. And it was 12 weeks, 3 sessions a week. They weren't long sessions, so you got to commit, all right? 45 minutes to an hour. And then here's the important thing. It's okay to have pain. I think a lot of people are afraid of the pain. Oh, it hurts, and then they stop. You can have a pain up to a 5, which is not, a 10 is send me to the hospital. 0 is nothing. 5 is right in the middle. All right, and it has to go away. It has to go back to the previous level of pain within 2 hours.
So if it doesn't, then did you just push a little too hard?
Yes, you did. And you go back to where you were able to do it without hurting. Right? That's what you tell your patients,
that's exactly what I tell my patients. It's so good that it gives parameters.
Not a lot of protocols do that. So let's get started with the exercises. So you go first.
I'm going to do the warm up, the pendulum warm up. Okay, so we like our pendulum swings, and pendulums are just something we use to get the joint moving a little bit. All you're going to do, you can lean forward on a chair or counter. You just let your arm dangle, okay? So if you think about like an elephant, how its trunk just moves when you move, you're not moving. You're moving your body and your arm just sways. The idea of this is that it helps to loosen like the soft tissue up around the shoulder. So you're going to do 10 times forward and side to side, forward and back, and you're going to try to even go in circles. So you kind of let your arm dangle in a circle. And it feels kind of good. And if you have arthritis in your shoulder, sometimes just letting it hang against gravity feels really good relief.
All right, I'm going to give you the slides. So you don't need one of these car polishers, even though they are very fun. Just a cloth would do. And basically what you're going to do is you're going to try to slide on a table. Okay, one bigger than this, but what you're trying to get is that flexion. So you're trying to get this direction, which is this, which a lot of people who have arthritis can't do. You're going to try to slide side to side. You're going to do some figure 8s. But all of these are to get some motion in there, okay? So if it hurts to a 5, that's good. I mean, some of you might slide pretty far. I mean, on a table, that's this high lifting your arm, which is great. All right, that's what you want. Okay, so table slides.
Okay, and then the next one you're going to do with a band, a TheraBand. So you can just get these on Amazon, anywhere they're readily available. So you're going to be my anchor.
Okay, and you're going to...
I'm going to put my safety.
So safety glasses. All right, I have glasses, I don't need them, but Dana doesn't. So these could break and they could hit you in the eye. So that's from the dollar store.
So just put some glasses on while you do these. Okay, so external rotation. I'm anchoring my elbow at my side. My elbow's bent to 90 degrees. And then from here, I'm just moving out into what's called external rotation. So my upper arm or humerus is rotating away from my body. And my range of motion is going to be dependent on pain. So I might only be able to go to here if that's my 5 out of 10, and that's what I do. Or you might be limited by the joint, and that's you just work within your available range of motion 10 times.
And this has to be anchored into something sturdy, okay? A door that isn't opening your direction that somebody could walk in.
That's a really good point. I have seen that happen.
Yes. All right, so the next, because there's a lot, is scapular protraction, retraction, which a lot of people standing like this, we want you to get like this. So you're just going to literally, your hands are going to hang in front, and then you're going to make your hands hang in back. So front and back. All right. And again, 10 times to start on any of these. And then if you feel like you can do more, build up to 30. All right.
That looked like it felt good.
Yeah, it did feel good. I loved it.
Okay. So then you're going to do another one with the TheraBand. So this is called scapular retraction. So it's like an advancement of what you did. And then this one, if you have like banisters, this is great to just anchor it around a banister. Or you can tie a knot in it and close it tight in a door. But from here, it's the same exercise that Carole was doing, but you're just pulling back with the band. So you're adding resistance, really moving the shoulder blades, opening behind me. Same thing, 10 to start, add a second set in of 10, and then a third set.
All right, so flexion is, you can do lying down, which I'm just going to show you standing up, but basically trying to get your arm up in the air. And what you could use is the other hand to help pull it up in the air while you're lying down. Try to get as much flexion as you can, okay?
And then the last one is with the band again. So you can't see my foot, but I'm stepping on the band here down on the ground. Put my safety goggles on.
Without poking
It's all right, I got another. And then here, you're gonna do shoulder flexion. So again, the same movement that Carole demonstrated, but you're doing it with resistance. So from here, I'm pulling the band in front of me. Now this one, it's important not to hike up through your neck muscles and your shoulder. So you wanna keep everything open, like your neck is nice and long. And then I'm just pulling up in the range of motion that I can pull in. So it might be here to start, and then going a little bit higher as you're able to. So those are the exercises.
Yeah, a lot, but I think if you try and you do it to the point of the 5 and then it goes away, I think you'll get some really good improvements.
Yes, I agree. Be patient with it. You're going to improve mobility and you're going to improve strength.
Yep.
All right.